As I said, I am your present under the tree today.
Can't care more than the client. I am I've been in the field for however many years, and I have taken a long time to realize that.
I don't think people are very good at taking care of themselves outside of work.
So we did one lateral x-ray. It was a right lateral, and the liver was massive. Don't judge yourself so hard.
Don't be afraid to hire people. People think, especially veterinarians, think they don't have the money to hire a practice manager or don't have the money to hire somebody for marketing or whatever it might be. Mm-hmm. Hire them. Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, because it's a Christmas episode, or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
Mm-hmm. If you're not watching, I recommend going to YouTube and watching, because Dr. King is... wearing Christmas presents.
As I said, I am your present under the tree today, along with my cohorts here, all dressed up, ready to go for Christmas.
Yeah. We're cozy and we're ready.
Mm-hmm. It's the holidays. It's the
Jingle
holidays.
We're actually going to carol the entire episode.
Oh my gosh,
Christmas
can we?
No.
No. Okay.
Should we sing everything?
No.
Guys.
Let's do it. Let's sing it. Okay, let's try it. Let's see if I can do it. Hello, everyone, and welcome to.
It's so bad.
You need to be higher pitched. Higher pitched.
Episode. What?
It's beautiful.
Thanks, Courtney. I can always count on you.
I'm your hype man over here.
That's right.
I'm your hype woman.
All right. Reviews. Peace.
Yeah. Guys, we are up there with the Spotify. Somebody hammer. Last time, it's too far away. The gavel.
Attention.
There's no way. I don't know how long ago this was from, but previously on Spotify we were at 276. Now we're at 292. Wow. And then we're still at 115 on Apple Podcasts. So I think the next goal is 200 on Apple. Is that right?
Mm-hmm. I think so. That is our goal.
That's when we're going skydiving.
No, we are not. That is when you decided you are going skydiving.
You were going skydiving, and we will be there for emotional support.
We'll be there to catch you at the end.
That is right.
Oh my gosh! No, I'm gonna crush you. I will not go splat. Okay, don't forget to check out those social channels, Instagram and TikTok at the Veterinary Roundtable, as well as YouTube, where all of our video podcasts are published at the Veterinary Roundtable. Head over there now, like Devin said, so you can see our festive Christmas outfits. Mm-hmm. The attitude coming from King right now. She has a massive bow taped to her face.
I think this thing is awesome.
We made her a strapless
it's like
dress.
having the hair you've never had.
It is. It really is. Because it's like
you've never had.
Hello.
She hasn't had long hair for like a while.
Hello.
I know.
Yes.
Okay, anyway. It's like to have a ponytail. And then just remember to check out our series of podcast episode revolving around Proposition 129, the hot topic right now. We did an episode with Dr. Steele, Mark Cushing, and Dr. McCormick. It is the best place to find insider information on the situation.
You know what?
Hot.
It's hot. It's so hot. I can't touch it. Somebody get the hot.
But we touched it.
I know we did. One of our teammates at work said to me today, how long am I going to have to wait for the next episode about Proposition 129 to come out? Is it going to be like 2 weeks because I have to wait 2 weeks like the other ones? And I was like, well, It is. You kind of are going to have to wait.
The anticipation.
I also want to go on record saying that the president of the AVMA applauded us for our conversations around Proposition 129 and said that if we wanted, he could be on the podcast.
What?
Wow. Mic drop.
That's news to us.
Okay, that's pretty exciting. So we can interview the head of the AVMA and ask him some other questions besides just Prop 129. Hey, if you have other questions you would have always wanted to ask the AVMA guy.
Yeah. Let us know.
All the knowledge.
Send them.
The president himself.
Mm-hmm.
Yeah, I was on the way out of the clinic just now, and I had my red scrubs on, and somebody was like, you going to go interrogate somebody else tonight?
Line them up.
I think we just have really just good conversations and questions.
That's exactly right.
That's our goal.
Absolutely. So that's pretty cool. It's like a series. Yes, you're going to have to wait just like every other show.
We have to
wait till we
build
film
the suspense.
That's right. But check them out because they are very informative. So.
Yes.
Another hot topic.
Mm-hmm.
Oh, yeah, it is.
The hottest of the topics.
Guys,
it's like a month away.
Hot
I know.
Florida. Hot Lando.
Hot Lando.
But why?
Oh, but why? That's a great question, Courtney. Because the Veterinary Roundtable will be live at VMX in Orlando, Florida on Monday, January 27, 2025 at Old Red. And if you don't know what VMX is, it is a big veterinary conference that is hosted there every year.
Every year.
Yep.
And if you've never been, you should go at least at some point in your life.
Yes.
And why not this year?
And there's
'Cause
lots
we'll
of
be
things
Why
to do.
we're there.
Even when you're in school. I mean,
Even when
I
you're in
get
school,
it's harder
yeah.
when you're in
Well,
school.
they have
but-
certain rates for like students and
Yeah.
whatnot, so
Yeah,
it's
still
a lot
learn.
cheaper.
It's a great learning experience.
Who's gonna
be a good time.
MC it?
The one and only Dr. Molly Brinkman.
That's right.
At Dr. Molly Says.
And
She's
when is
hilarious.
it? What time is it, Courtney?
It's from 7 p.m. to 10 p.m. And
in addition to the show, there will be a game show, partying, and lots of networking, meeting cool people, and just getting around. It'll be a good time.
We're gonna start off with a
Veterinary-themed
podcast.
drinks,
Oh yeah.
food.
Oh wait, go back to the drinks. 2 free tickets.
No, 2 free drinks,
free drinks per
ticket.
ticket. You said 2 free tickets.
Oh, 2 free drinks per ticket. That's pretty awesome.
So
though.
yeah, 2 free drinks.
I mean that like pays for your ticket right there.
Easily.
Yes. And VRT merch and crazy prices.
3 hours of content.
Yes.
Mm-hmm.
Yeah.
$1,000
are-
gift cards.
yeah.
What the Sam Hell?
I think it wasn't a gift card.
Can I put our name in it?
I know,
Jeez
yeah.
Louise, I could use that.
Okay.
Yeah.
Okay, all your favorite influencers, veterinary influencers will be there. Dr. Crocker, Dr. Deere, Sarah Parsons, just to name a few.
Mm-hmm. All ticket proceeds from the live show will be going towards the Companion Project, which is a wonderful nonprofit that provides veterinary care for animals in need. Oh.
Oh, that's
So you're donating to a good cause.
The Companion Project just became a 501c3.
Mm-hmm.
Dr. Molly Says posted that.
That is correct.
So it's official.
It is moving down the line. That's right.
Moving on up.
Exciting things.
Get your tickets now. Boom.
Boom
Click it.
sauce. I'm Devin
the link.
Fortune.
I'm Dr. Ashley Duckwall.
I'm Emily King.
And I'm Courtney Allen. Whoop, whoop. And you're listening to the round table.
And there we
On
go.
Christmas,
Round table.
but guess what? Because it's Christmas season, we gotta surprise.
No, surprise
No,
bag.
Did you see? I know
Woo!
that's big bag.
I
It's
thought you
really
didn't
big.
see this?
No,
It's not like registering with me.
It's like
I
massive.
definitely thought Devin would have
What's
seen
in
this.
the
to begin.
bag? We haven't had a bag for a
You
while.
have- ladies and gentlemen, if you have not seen this before on our show, we have surprise bag literally randomly. We never
Randomly.
know when it's going to happen.
Yes.
Hence
This
the
is
word
my
surprise.
first time doing it, and it's Christmas season.
She's
so
been passed the baton.
yes, I'm very excited. It worked out. It worked out well. Okay,
Okay.
you're all going to get something, and you're gonna.
Sorry, I'm crinkling.
She's ripping.
Her dress is about to fall. Rip off. That's a wrapping
Keep your
paper
clothes
dress.
on,
everyone.
gang.
Keep the
Calm
clothes
down.
on. Okay.
Look, first we'll
Oh.
start off by
Ooh.
my amazing horse blanket that I used to cover it up.
Wow.
Yeah. Isn't she beautiful?
Oh, that's
Okay.
cute.
You can't have it. It's mine.
looks like spirit.
Oh.
It does look
I
like
know.
spirit. Yes.
You're
Majestic.
involved. Harrison's involved if you want to join us.
Mosey on over here, Harrison.
Come hither. Act like you love us.
Or not.
Hello.
Paging the producer. Paging the producer.
R.I.P. headphone
We'll
listeners.
just-
We'll just hope he has
Ooh,
headphones
these
and
are like
isn't
in
ignoring us.
bags of their own.
Yeah.
This is so exciting.
This is
Pretty hefty.
Oh,
Pretty hefty.
Oh my goodness.
thanks. That was so sweet.
This is
If it's
Courtney?
alcohol, Connie.
Look how cute these bags
No,
are.
are you gonna ice us?
I don't know. Okay.
It's not heavy enough to be
Harrison.
nice. Okay.
Harrison Branch.
Crickets,
throw
guess
something
I'll
at him.
just return
Get
it.
away.
Get the positive potato and throw. Can you throw it that direction?
If you hit the screen,
That's
can you
not the
imagine
positive
if you-
potato. That's the
throw it over my
pineapple.
bag.
I'll get in trouble. It's
Okay.
fine. He'll just.
He is straight up acting like he's not even back there.
It's
don't-
fine. He'll just.
Should I
The
call him?
surprise is ruined for
Okay.
him.
Okay.
Okay.
Where's my phone?
Are we doing it on 3?
Yeah.
Oh.
Okay.
Oh, that's not 3.
1, 2, 3, go. Oh, I love Christmas. I love Christmas.
What? That's
Shut your freaking
Yes.
mouth.
Stop.
Oh my gosh, this is amazing.
Shut up.
Are you serious?
Show it to the camera.
Shut your
Look
mouth.
at this.
Just show him the other side.
And look at this.
so cool.
Oh my god. How did you? That is so cool.
Yeah,
This is great. This is because we
I'm-
always have these
know.
random cups and drinks.
I know.
This
and
is so cute.
I'm too stunned to
Duckwall.
speak.
This is really cool. Thank you so much.
Now,
Wait, wait. Time out. If you're not watching, I'm going to describe it real quick.
Okay. Oh, good
It's a
idea.
little mini red Yeti cup.
Really.
This
And it
is
has our
sexy.
Veterinary Roundtable logo.
Sexy.
And it's like raised.
Yes, it's really
and then
cool.
on the other side, it has our names.
Very cool. Very, very
It's okay,
cool.
Barney, to my house.
Thank
Everybody
you.
close your eyes.
Okay.
Uh-oh.
Oh my! I can't.
Put out your hands.
That's
please.
really, really pretty, actually.
It's the most beautiful thing
I
I've
hear
ever seen.
clinking. I'm
That-
scared.
Wait.
She iced us, didn't she?
Definitely.
Oh,
did
Harrison's
ice us.
finally listening. Okay.
Now he's laughing.
Oh dear. Here we go. Everybody get ready to get drunk. It's
Okay.
it's cold. Mm-hmm.
On 3. 1,
wonder what
2,
it could
3.
be.
Open your eyes. The naughty and the nice elf showed up. You've got ice.
Are we supposed to do these right now?
Yep,
Like,
you have
actually?
to.
I cannot. I'm driving to
You have to
Nashville.
get on a knee.
Cheers.
I can't
Well, you can
open
have a
mine.
sip. You don't have to actually chug
Can
it.
you open it?
Oh, now you listen.
Oh yeah, now yours is
Only when
over here,
alcohol is
Harrison Brand.
involved.
You have a bag over here for you.
Now he knows what he got.
I can't
He
tell you last
ruined
time I
the
had Smirnoff.
surprise.
It's so
Did you hear us talking about
Open
you?
it now. So
Oh, you
So
ignored us.
funny.
Okay.
LOL.
I haven't had a Smirnoff since like high school.
yeah.
Oh my gosh, this is really. I am really
yeah,
flabbergasted.
so am I.
This is a really cool.
This was
surprise.
really thoughtful.
This is the sweetest thing.
It is so.
Merry
That's so
Christmas.
amazing.
Merry
Thank you so
Christmas.
much. Love it.
Thank
Thank you. Thank you. You're,
You're
so
welcome. Cheers.
Wow,
Cheers.
that's so nice.
Cheers! Cheers! Cheers!
It's literally the perfect red.
I know. It's
That's
It's like the
Courtney,
perfect color
Courtney,
of red.
show the cup
how well it
to the
matches.
camera.
Show what?
Show the cup to the camera.
Oh,
so that
sure,
people can see it. Real detail.
Okay.
There you go.
This is the
I was so
front.
excited.
Duckwall
Okay.
is like the
And then
happiest
this is the
she's ever
other
been.
side.
love
It has
giving
our
gifts.
name.
You look like Helen.
It matches my nails. My nails match the set.
Everyone has a different
Oh,
font.
we need to bring these to.
I spent a
DMX.
week time trying to figure out which font fit
It totally fits
everybody,
me.
and
My-
there were only so many options.
No,
yours look
mine's
like?
perfect.
Mine's
I
still
love
different
it.
than mine. Courtney and I's kind of look this similar, but I didn't want it to be too cursive-y either.
I like how
it.
you did mine. 'cause it's
Harrison
like,
has his own as well.
It's so perfect. Thank you.
Yes, it is perfect.
I do love the font. It was the
Okay,
first
good.
thing I thought of.
That is so sweet.
All right.
God
well, my
bless.
peak has just changed.
Wow, that's
Of the
great.
week.
Thanks.
Where's your ice?
I can't drink it because I'm driving tonight. 5 hours. To
Yeah, that's
Nashville.
the
Oh
far
my
drive.
god, where?
That's okay. Way to be responsible.
Where are you driving?
To Nashville, Tennessee,
Why?
to do some
Oh,
work
yeah.
tomorrow.
It's so sweet.
All right,
Okay,
pits and peaks. Go for it.
Who wants to start?
I can start. Okay.
Does anybody else have the problem of you think about this earlier in the day and then when you get here you forget?
No, I thought about this 2 weeks ago because we've been doing so
Yeah,
many
that's
guest
the thing.
episodes and now they're all
Oh,
gone out of my
interesting.
brain.
I think of the good,
Yeah,
I
I-
just go off what I feel for the day.
I think of the good pit and peak, and then like 2 weeks pass, and then I feel like a liar using it for that week.
Okay, well,
I
I'm
see.
going to go with
feel
the day.
fake.
Okay.
Okay.
Oh, you want me to go?
Okay. Yeah.
Sure.
Go.
Okay,
Good.
I would say because it's the holiday season, it sometimes can be overwhelming to feel like you can remember everything. Hence
Yes.
my outfit for today. Or the fact that I have all my children's presents in one room in my house and I have no
Oh.
idea if I remembered everyone correctly or not.
Oh, I see.
And
That's
then
okay.
you
That
know,
happens to a lot
then
of people.
then a couple of days before Christmas when you have time to like actually audit everything and go, oh, then you
Then you scroll.
always forget, and the person you always forget is always the person that you forget.
Is it always the same person?
Yes.
So you don't know if he's forgotten anybody yet. Who do you forget?
No, I don't know, but there's always somebody I'm like, oh crap.
Yeah.
I should have gotten them this, or I should have done this, or whatever.
Yeah. Do you?
It's a lot of
do
pressure,
you have
peeps.
the
It is.
presents labeled, or is it just a mass exodus of presents and you don't remember who's for who?
Usually, now that everybody's older, I'll try and do similar items so that I don't make that mistake. I used to make that mistake much more frequently before.
Like you got it for someone and then you accidentally gifted it to.
No,
someone
just
else.
that I got that for somebody else, and then I was like, then I didn't get something else for somebody, so then that person has nothing.
I'm sure that's a
instead of-
very common problem.
Yeah.
yeah,
You have a lot of kids.
And they're
Yeah.
all boys.
and they're all boys. But now they're older, it is easier. I will say
Yeah,
that.
that's good.
That's good.
You're doing
And
great.
yeah, thanks. So that's my pit.
My mom, without
loves
fail,
that.
forgets at least one gift every year. She hides it and forgets
Yep.
what she hides it, and then we'll find it later in the
It's funny.
month or
I've
the
done
next
that.
year. And then she
But-
finds it, and then we get a surprise gift.
Yes, it's fun that way.
Yeah.
I will say that I'm very happy though. My peak would be that I'm very happy about what I did choose to get.
Oh, good. Okay. That's good.
So I
for
feel
you.
good about that.
Yeah.
That's always
Yeah.
nice when you're excited
a
to
really
get
good
something. And
Yes.
it's like you know
feeling.
you nailed a gift.
Yes.
That is the best feeling.
Yep.
Yes.
That's good.
Mm-hmm.
This
You know-
isn't going anywhere. My mom better not watch this, but she asked for bird feed this year for Christmas, so I got her a 40-pound bag of bird seed.
I love it. That's
and
amazing.
she's gonna be so happy. Is the thing.
Harrison, when does this episode air?
I think it's after Christmas.
It's after Christmas,
It's
right?
the Friday after Christmas.
Yeah.
Oh, yeah,
literally
okay.
the
She
day
would have gotten
after.
her birthday.
Yeah, so she's gotten her
I
bird
hope
seed.
you
You're
like your
safe.
bird seed. I hope it's everything you dreamed of.
No. Then you need to get her a jar of peanut butter. She can make it all together with.
Oh
Isn't
my
that what people do with peanut
Yeah.
butter?
She
and, like,
the other day went to Ace Hardware and then came home and gave me a haul of all the bird feed she got, and she got like a bird feed wreath, probably 7 different things of bird feed.
wow.
Whatever makes her happy.
You know what
That's
you
her
know. You know
thing.
what you need to get her
What?
is that camera.
Yeah.
Oh, the camera bird.
Yes,
and
I
nature
see that
feeder.
everywhere.
That sits on the thing, and then the birds come up,
Yeah.
and they're like, doo doo
No,
doo
you
doo.
need to
I
get her
can
the
fit-
glasses.
and it's so cool.
and they sit right
Yeah,
there.
the birds will feed off of your face. Like you camouflage yourself, and then you put glasses on. You put a little camera in it, and they'll just sit on your face.
appreciate
well,
Yeah,
this
you
is
don't
the
have
thing
face.
the thing I'm talking about is like you attach it to the
It's
bird
on
feeder,
a bird feeder, yeah.
and they come up, and then you get to see all the different
Maybe I
kinds
will.
of birds.
I
gotta
can't
save
get her
that
any more
idea.
bird feeders because we're out of room.
I bet
Yeah.
you could find a good one
I'll
on
get her.
Amazon.
I'll get her a camera.
Get her a camera because then she can identify the birds and all that stuff.
And she could be so proud.
Does she
Yeah.
have a bird book, like an encyclopedia of bird?
Yeah, see,
Everything
she would love
bird.
that.
Yeah.
Everything bird.
Very cool. That's amazing.
Well, my pit is that I tweaked my shoulder. I think it's when I played tennis with 8-year-olds.
You were so excited about playing tennis.
I know I was, and
now this
I
is why
kid
you don't
not,
do it.
We actually haven't had time to talk about this. After I played for an hour and a half, I thought my body was shutting down. I was so sore and so
Yeah, you
worn
can't go
out.
from 0 to 100.
well. It's not like I was playing like I was in D1 tennis again. I was like dinking it over, and I'm
Again.
still sore. Anyway, I kind of low key wonder if I tore something because it's been hurting, but I can't. I don't have time to rest it. I have to scoop horse poop, and I have to take care of my toddler who wants held, and you just can't rest it. You got to
Were
lift
you-
dogs.
Were you like
and-
running across the court and everything?
when I was playing?
Yeah.
Yeah. Okay. Here's the thing. My competitive side is if my nephew couldn't reach it or get it, I ran to get it because I didn't want to lose.
See?
So I was going all out.
So it was
and-
doubles.
Yeah, it was doubles. Yeah, I wasn't playing singles.
Not as much
since
work. Okay.
Yeah. No, it's a good question though. If it was
So
singles,
fun.
I
I know my
would've-
tennis. I'm kidding.
If it was
I know
singles,
my
I would have
tennis.
quit. So yeah, that's a pit. It just hurts like all the time.
Yeah.
So that's a
I'm
bummer.
sorry. Are you taking your NSAIDs?
I'm icing it for
Heat it too.
for now. I
Ice
know.
and
Aren't
heat.
you supposed to heat it for the first couple? No, ice for the first
You
couple, and then
alternate.
you
You just alternate.
I'm just mainly icing after I'm active.
Mhm.
So all the time. My peak is that I finished all my gifts at a decent time and wrapped them all today.
Way to go.
Exciting. Wow.
So
That's amazing.
and it was like exhausting. I was
Yeah.
done with it.
Oh my
I was like,
gosh,
I need
it's
a
so much
nap.
work. Mhm.
Yes, it's a lot. But I'm
Good for you.
Yeah,
A full
thanks.
week in advance.
Yeah.
I'm slacking.
I haven't
It's
wrapped
okay.
a single present, but because my dog, I know will just mess with
Oh.
them. So I'm just
Yeah.
waiting.
That's smart.
I don't even have all my gifts yet.
I don't either. I'm such
They've
a
been
brat.
ordered, but they haven't arrived.
It's crazy out there. So
It
you
is
better go
crazy
I
get
out
know.
it
there.
I went
later.
out this past Saturday.
I shop
Never
online.
again.
Mm.
Never again.
I don't go shopping unless I'm going to TJ Maxx.
Mm-hmm. Okay, that's it.
Okay. My peak is probably this episode, honestly. I feel like we haven't had a normal episode in a while, so it's just nice to be one little happy family again.
Without the guests in our house.
No guess.
My pit is like much more of a pit than your guys', I feel like. I don't mean
Yeah.
to invalidate you,
Okay.
but
Thanks, Devin.
it's that I had my first behavioral euthanasia today. Like it's a lot.
Oh.
It's a lot it's
Starker.
different.
Starker.
No, but it was. I mean, I've obviously helped with other ones, and like I know about rabies testing, but it was my first patient that we actually had to do it on, and it was just a rough situation. Like it has a bite history. The mom didn't feel comfortable coming, so the dad came alone, and then we normally do aftercare, like paw prints. So I asked, I was like, do you want this stuff? And they're like, no, it's traumatic. So it's just,
Aw.
it stinks.
It's a crappy
Yeah.
situation.
2-year-old Basenji.
Yeah.
Mm.
But they've only ever had Basenjis and they've never had this issue. But apparently they rescued him and he already had 2 strikes that they didn't know about. And then they gave him a chance. So I was like, you gave him the best chance you
Yeah.
could. But
They took him on. I mean,
just unfortunate.
yeah,
It is
that's
so
Not a
hard.
fan of behavioral use. They're never easy.
Yeah.
I mean, no euthanasia is easy, but
Yeah.
makes it a little harder.
Mm-hmm.
Well, good job for being there for our client.
Yeah.
Thanks.
Yeah.
You did your peak? You said
Yeah,
this
it was
episode.
this episode,
Okay,
yeah.
sure. My peak is this past weekend. I went to Cleveland with my husband and my brother-in-law and my father-in-law. It was my brother and father-in-law's Christmas gift. So we went and saw the Chiefs and the Browns. The Browns got smacked as I predicted, but it was still a really fun time. Taylor Swift was not in the stadium. I didn't go for Taylor Swift, but she was not
you
there.
did bring it up before you went.
Yeah, because I know a lot of people would ask me. But Taylor Swift was not in the building. My pit is, I don't know.
Wow, that's a first for you, I feel like.
That's good.
Oh.
Courtney, maybe your pit is what your
That they
the Instagram
lost?
story was that I posted the other day.
For RBF.
Okay, my pick. If you don't follow our Instagram, we'll go follow our Instagram because you would see things like this. But on our story, I was watching the podcast the other day because I haven't watched in a really long time or listened. So I was like, I'm just going to catch up a little bit. And I didn't have anything else to watch. And I noticed, which I knew I had this problem. I have RBF, where personally I think I do. And all of my family and
Oh,
close
you
friends
do.
have told me I have RBF.
And
And
for negotiation.
I mean, Molly, when she was at the clinic, I don't know if you remember, but she was filming with Duckwall and she was like, is Courtney okay?
Yes.
And Duckwall's like, yes, she's just working. Like,
Right.
I have a face. And I noticed because I think it's the angle I look at you at, it's kind of awkward. And so I look like I hate Devin. So I just wanted to clear the air and make sure people know I love Devin. Like, it's just,
Yeah, now
I
you have to
love
hold
her.
hands the rest of the
and
episode.
it's just, I need to work on it, but I don't know
Did
how to
somebody
work
say
on it.
something to you or something?
No, I saw it.
Oh,
like,
you
it's
saw
really
it.
bad
Okay.
sometimes.
I mean, I knew you had RBF, and I knew you didn't mean it, and I was never going to say anything, but I did appreciate that story.
I really like. I'm just sometimes I'm listening to you so intently that I don't realize what's happening
like-
with my face,
Yeah.
and then I just look down. And I look like I'm pissed off and annoyed that she's
It happens
speaking.
to everybody. It's fine.
I know, but mine's really bad.
Yours is pretty strong.
So I'm gonna work on that. New Year's resolution.
New year, new me.
A new year, new me. There you go.
Okay, yeah, that's my pit. I don't dislike Devin.
Okay, that's good. Get
I
that out
truly
there.
care
Good to
about
know.
what
Good
she's
to know.
talking about.
All righty.
Okay.
New trending veterinary topics.
Mhm.
Mm.
We have a couple for tonight.
Yeah.
Yep.
Our favorite category.
Break it down for us, King. Looks like you've got some
Yeah.
papers.
We got the pet population continues to increase while pet spending declines.
Wow.
Not
I don't
news.
think it's a shock that
Yeah.
pet population
Old
has
news.
increased. That's pretty.
Yep.
I think.
I mean, that's
par for the
started with
course,
COVID
right?
faux show.
Mm-hmm.
Let's see here. But the thing I found interesting about this
wanna
article,
pull it
and I
up.
don't know if anybody else
I'm stuck
Where
at
was it
home. Let's
in
get
here?
a puppy.
I'm going to pull up the link.
was where they talked about the owner spending. And where's the number? Where's
Yeah, you said the average
number?
transaction is less this
Yeah,
year than it was last
I
year.
want to read the number. It's in
Didn't
here
it have the
somewhere.
Oops.
Okay, here we go. The average cost.
That's that drink.
The average cost of a veterinary visit, which includes all costs for all pets seen, even if the visit includes multiple pets, was $190 in 2023
What?
and $147 in 2024. Dog visits had the highest average cost for both years at $265 in 2023 and $214 in 2024. That's significantly lower. Cat visit. I only know this because in homeschool we're doing proportions. Okay, sorry. And ratios. Okay. Cat, if anybody wants to know how to do that, just hit me up. I'll tell you. Cat visit average costs were about half that at $163 in 2023 and $138 in 2024.
Wow.
I mean, those
Wow.
are significantly lower.
Yeah.
Yeah.
I mean, I think at our clinic we're seeing the average client transaction is also lower, but it's not as the same ratio. So it's like maybe $5 per average client transaction on the dashboard anyway.
Which is we were talking about before we started is it's interesting, like why did it go down in the past year? And we were wondering if I don't know what's changing with because it's starting to slow back down to where it was prior to COVID, like schedule wise. I feel like after COVID there was just like this just constant busy schedule.
Everybody
we had
got
had.
puppies because they were stuck at home.
Yeah. And that just kept going
Mhm.
though past, everything COVID
Yeah.
getting released or the restrictions getting released
Right.
and stuff. But now I feel like we've truly hit a winter season where we're much slower, which was how it was prior to COVID.
Yeah.
So it's like it took many years to get back to the
like normal
The normal
or the baseline
patterns.
or whatever.
Yeah.
Overall, average spending on veterinary care decreased by 4% between 2023 and 2024.
Dang.
The number one reason given by both groups of owners for not spending on veterinary care was because the dog or cat, in quotations, did not need a checkup.
This
Notably,
is nationally, right?
12.3% of the dog owners and 17.4% of the cat owners gave this reason in 2023, but those figures jumped to 22.8% and 31.1% respectively in 2024.
Wow.
Yeah.
Holy cow.
So I think that, and kind of like actually in all this VPA stuff, we've been talking about this, like where people are just coming in like if they need something.
Yeah.
Yep.
Do you think the numbers are doing that because of the increase in price? Do you think they're related?
I don't think that, it may be. I think it just the general landscape, the financial landscape across the
That's
nation
true.
would suggest
That's
that.
true.
But this is higher. These changes are. Harrison, where did we have that post? When did you guys post on where they were talking about the prices going up at a different rate than
I post in
Did
our
you talk to-
group text.
okay, yeah. Yeah, so like inflation versus the price
Mhm.
of veterinary care, like
Oh, yes, I texted. Yeah.
yeah. So like I don't know, maybe there's some I don't know.
It's just the wheel we keep talking about.
It's the wheel. It's the treadmill.
The
We're on a
prices
treadmill.
are going up. So are tuitions.
People are spending money elsewhere, maybe,
I wonder if other fields
Yeah.
are
and
experiencing
putting their
recession.
dogs in like the back burner.
Well, other medical fields, they're going to have insurance. I think it's a much,
Right.
if we're talking human medical fields, it's just a totally different
Right.
ball
yeah.
game
Yeah.
because it's all insurance driven. So
Sure.
it's third party payer. Anyway, interesting article.
Interesting.
Yeah.
Well, I'd be
AVMA
curious why
published it.
people think they don't need a checkup. Like, why do you feel that? Because they seem fine on the outside, and so you just want to save the money? Probably.
Yeah.
They're not
That's
sick?
what I would guess.
Yeah.
Anyway,
Okay.
it's very
I
interesting.
don't know.
I think that's probably what they're thinking.
Yeah.
They just seem healthy.
Or they don't understand
They're
the
eating
importance of
fine.
vaccines.
They're
or-
playing fine.
I
Yeah.
could see like a lot of the cat owners that get 3-year vaccines, they
Sure.
don't see the importance of coming in for just an exam.
Yeah, I feel like
the
we've seen
second and
that. Like,
the first. Yeah.
And I think
I
the
would
thing
agree.
that in this study that speaks to that is that 86.8% of dog owners identified as having a regular veterinarian in 2023, but it was only 74% in 2024.
Mm-hmm.
So like maybe
also could be because they're not getting into regular vets. So then they don't want to bother with it. So get your clients in your schedule. We say yes. And guess what? I feel like we have good client retention because we always help them out.
yes.
Bazinga.
I don't know our
Exactly.
percentage for client retention, but
I'm sorry.
I don't know what our percentage is for retention.
The churn rate
but-
is you can figure out the churn rate, but it's hard. It is hard. It's
Yeah.
a little bit tricky as far
Yeah.
as like a equation goes. But yes,
Okay, next topic. New Jersey Vet College achieves first steps in accreditation process. It's great. Getting
We
more.
love to
Wonder-
see it.
Wait, what's it going to be? Rowan University?
yeah, it's
Yeah.
a really cool building. I don't
Yeah,
know if
it
you
looks
guys.
cool.
Yeah,
I
it
saw
looks
the
really
picture.
cool.
It
The
says
pictures, the
they're,
sketches.
there's a link.
It didn't work.
Oh, it says they're accepting applications for students who will enroll next fall, so fall of 2025.
Yeah, that's
Whoop,
pretty
whoop.
The
quick.
only
That's
bad part
soon.
is
Yeah.
it's in New Jersey.
Yeah.
Okay,
I
but
mean, it's cold.
some people like Jersey.
It's cold. I'm just saying it's
the
cold.
Jersey Shore.
Yeah.
Yeah. I don't know.
But if you're
close to
from
New
there-
York City,
Then maybe it's like
And it's
a
near
plus
a
plus.
beach.
Yeah, they got a lot to offer out
Certainly
there.
have to have decent
I've never been.
summers.
I don't know.
I'm not
summers
hating
are
on
fun there.
Jersey.
Yeah,
You what?
they are.
I said I'm not
I did
hating
not know
on
that.
Jersey.
Mm-hmm.
You know,
I mean, I would say the same thing about people coming to Purdue.
I would say the
Well,
same
it's in
people.
Indiana.
I was gonna say
that
yeah.
sucks.
I mean, wasn't there all the joke for all those years about Terre Haute? It was the armpit of
Terrible
Indiana.
Hope?
Yeah.
I think
My
I
friend
would
went to
choose
school
New
there.
Jersey over Purdue.
You what?
I think I would choose New Jersey over.
Would you
Indiana.
really?
Just like if I didn't live
Taking
in
money out of it.
No.
I would have definitely not gone to Purdue if money was out of it and I could just kind of
Pick
go
it.
wherever.
If I
whichever
were from
location.
a state that wasn't Indiana or New Jersey, I would choose New Jersey because it's by the ocean,
Fair enough.
or at least closer to the ocean than Purdue. I
One
don't
of the
know.
things
That's
that
fair.
we were talking about was the price of
Yeah.
tuition.
Yep. 37,000 for
Something.
in-state
Yeah.
and 52
For New Jersey?
53
Yeah.
some.
I mean, 37. is low? Because then you went and looked up Purdue.
Yeah, I looked up Purdue. Their first year's what I say 40,000.
So
And the fourth year is the highest number, which was 47,000 for
there's
Purdue
a picture of it.
for 2024 to 2025.
Yeah.
Which is still a lot more than what I had to pay 5.5 years ago.
Yeah.
So it's still crazy how much it's gone up in a short amount of time.
Oh, the continuing talk about money.
Oh my gosh! Wait, do normal vet schools have galleries to watch surgeries, like up top?
It depends. Most of them, yeah.
Like
in Grey's
in
Anatomy?
this picture, it has a gallery.
Yeah,
up
isn't that
top.
cool?
That's
Tennessee-
so
yeah,
cool.
mhm.
That's so cool. Wow.
Wow.
Yeah.
The things we're amazed by.
I know. It's very cool.
Well, good job, New Jersey.
New Jersey.
Woo!
It's additional veterinarians being produced
That's
in
right.
the next 4 years.
Look at that.
New Jersey won the race. It
DVM's
appears.
being produced.
I wonder what's next.
All right.
Where's the? All right, never mind.
Listener inquiries.
Are
Inquiries.
we gonna do cases at any point?
Hi, friends. What books do you recommend for people trying to start a new business from the ground up with no prior experience in the business field? As well as any advice you have. From Anonymous. Take it away, King-a-ling-a-ding-ding.
Was this a coincidence
Why?
because you posted books
Oh,
today?
please,
on
I know,
there?
that's
No,
what
I
I was
didn't.
thinking.
I totally just took the picture of the books because I was like,
Just
it's
wanted to
Christmas.
foreshadow.
These
You
are
just-
great stocking
You just
stuffers.
read a lot of books.
And I read a lot of books.
Who moved my cheese? Who moved the cheese?
Oh, what?
Yes, that
Yeah.
is true. That's a good one. Okay, okay, that would be your vote for them? For
Well,
starting?
I don't think it would be from the ground up. I think
Okay.
that would be once you got everything established and your staff established.
Okay, I
because
like
it's about
it.
change. So, like,
Yeah.
off the bat, you don't, I mean, there's change because you're opening something, but I think that would be later on in the business,
Yeah.
personally.
I like it.
Yep.
I don't read books.
Okay, fair enough.
The only book I've read from you guys is Jordan Belfort.
Okay, that was a good one, though. That was good for you to read.
It was
What-
good.
Okay.
Which one was it? Way of the Wolf?
Yeah.
Yeah. I liked the is it Extreme Leadership?
Yeah, extreme ownership, I
Ex-
think. Extreme leadership, extreme ownership. Look at my picture.
I was
It's
gonna
in
say
there.
it's whatever one I read when I first
Jocko
started.
Willnick and
Yes.
yeah,
Yeah. It's that one. I liked that one a lot.
that's a good one. That's really good if you want to know before you start
Mm.
what you should be like.
Crucial conversations.
Crucial conversations.
Yeah, Crucial Conversations is just a
Oh,
good one.
That's
Yeah.
that's just a great book.
Yeah, that's a very good book.
For
I
life.
would say if you're starting a new business, probably my top two. Well, there's probably Donald Miller. Anything written by Donald Miller. So he has how to build a story brand, and then how to build your small business from the ground up or something like that. There's those two by him are fantastic if you're starting something new. And then there's a book called Traction that is fantastic, again, for starting your business and like knowing what you should be doing. How do you build a mission and a vision and like a step-by-step thing?
Okay.
How to build a story brand is really about like identifying who you are and then how to sell that.
Mm.
And so I think those are great resources.
Well, I will say we even had that discussion when we started up too with our roundtable stuff.
Yeah.
We were like, what's our goal? Like we have to come up with a goal and what like your mission to achieve that goal is and
Mhm.
make sure everyone buys into it.
What's the
So,
point?
Yeah. So I think it's any size business you have to have the
What
same.
advice would you give them?
Don't give up.
Okay.
It's rough at first.
Okay.
She made it work. You're very successful.
I've never started a business.
Someone argue, no, what?
You have. We're doing it now.
Yeah,
Oh.
exactly.
Get a bank account.
Okay. Okay. I have a bank account. Okay.
I think it requires a lot more, I guess, flexibility in the beginning too, when you're getting your feet under you and like
Oh yeah.
trying to work it out for the long game.
You have to be able
It-
to make sacrifices.
Yeah. I mean, that's kind of when you're starting off too, and you have to just kind of
Mhm.
establish your niche or
Mhm.
whatever, no matter what it is.
Mm-hmm.
You have to give to get.
Did you start All Star completely alone, or did you? I mean, you had Richie. Did you have anyone else,
That's
or was
it.
it just you two? But at least you had one other person. I can't
Yes.
imagine doing that alone.
Yes. We had one. It was just the two of us.
Yeah.
And we went to the bank and said, can we have $100,000? That's what we started the clinic with, which is laughable.
Yeah.
Because we burned through that money in like 9 months.
Mhm.
And then was like, what are we going to do? So I think we even wrote a business plan because that's Richie, right?
Yeah.
And so I think a business plan is very important just so you kind of can project some numbers. but I think ultimately just knowing what you're trying to accomplish. And that's where the book Traction comes in, because it lays out all of, kind of like you were talking about, niche. What is your niche? You know, who is your key person you're marketing to? You know, so like, what does your ideal client look like?
Yeah.
You know, you got to know that information, because that's going to then help you decide, what is your marketing going to look like? What is your services going to look like? You know, those kinds of things.
Right.
So otherwise, you can try and just hang a shingle, but then it gets really confusing because you're trying to service the needs of everyone, which is really, really hard.
Yeah.
And you fragment your focus then. So it's really important to know what you're chasing so that then you don't fragment your focus.
Keep the end goal in mind.
Exactly. And I do think that's important, Devin. Start with the end in mind. So if you know where you're trying to be, then you could kind of work backwards a lot of the time as well.
Gosh, I know it's not a business, but sometimes with school, I'm like, the end goal is just getting my license.
Yeah.
All of the struggle will be worth it.
And then I would say surround yourself with people that know more than you,
Mm.
for sure.
Yeah, you've said that before.
Yep. Always hire people that know more than you. As veterinarians, if this is a veterinarian, we're not sure because it's anonymous or whatever, like, I didn't know anything about business. So, like, I'm not going to try and run a business.
Right.
Like, that doesn't make sense. I can learn, but I can't. I mean, I don't know anything.
Mm-hmm.
So you hire somebody that knows how to do that, or, you know, whatever it may be.
Yeah.
So don't be afraid to hire people. People think, especially veterinarians, think they don't have the money to hire a practice manager, or don't have the money to hire somebody for marketing, or whatever it might be.
Mm-hmm.
Hire them and just do what you're good at, which is being a veterinarian. Those are my pieces of advice.
Mm-hmm.
I think it's great advice.
Thanks, man.
Good starting points for them.
Yep. Yes,
Anonymous.
for sure. Okay. Next one, also from Anonymous. I just recently came across this podcast and I love the vibe you guys have. Please don't change. Sorry. I don't like the way I said that at all.
Restart.
I just recently came across this podcast and I've loved the vibe you guys have. Please don't change. Some background. I'm currently going to school for an associate's in applied science, my major being animal care and management. Along with this degree, we have the opportunity to sit for a vet assistant certification exam. I plan on going through with this and currently intern at a vet clinic. I'm not totally sure if I want to go back to college to become a vet tech. My questions are if you guys think there's a place for vet assistants at a hospital. Do you think vet clinics are moving away from assistants and more towards techs? What are the differences in duties between assistants and techs? Is it worth becoming a tech? Sorry for all the questions. Thank you all in advance for your time.
Valid questions.
Good questions.
Yeah,
Yeah.
great
for sure.
questions. So
Important
let's start
question.
with the first one. Is there a
Crinkle,
place?
crinkle.
Is there a place for vet assistants at a hospital?
Yes.
Yes.
Absolutely.
110%.
Absolutely.
Yes.
For sure.
Agreed.
Yeah.
Where? Let's name it.
At All Star, I feel like we're structured uniquely, but we have vet assistants, which are technically room assistants, and then we have vet assistants that function as technicians, and then we have credentialed technicians.
Mm-hmm.
I know some other clinics have just vet assistants / technicians, and then doctors, like they're the same role. They go into the room and they do the treatments. Yeah. I mean, I guess-
speaking from our clinic, we use vet assistants in the treatment area for like restraining. I mean, depending on the experience, obviously administering vaccines and administering some medications.
Some
high
patient
school
care.
students
Some
are
patient
technically-
care.
You know,
Yeah.
like walking patients.
Yep.
Yep.
You know, those kinds of things. Sometimes even taking out catheters,
Yeah.
depending on how skilled or how
Yep.
how.
Getting the
We've-
surgery stuff autoclaved and
Mhm.
cleaned and packed, like getting the surgery packs together.
Our high
stuff
school
like that.
students are technically considered vet assistants, and they just come in, clean, and help us
Mhm.
Restock.
train and
Yeah.
Yep.
restock.
All things that make the
They quite literally keep us
function.
afloat.
Yeah, literally.
Yeah. Laundry. Oh
Um,
shoot, can't even imagine how much
Yeah.
laundry we
They
have
do
a
the
day.
tech appointments,
Mhm.
Yep.
which is a huge help.
Yes.
Because
Mhm.
if the technicians like that were assigned to doctors had to do that as well, we would burn out really fast.
Mhm.
Yeah.
That would be a lot of work.
I bet some vet assistants work at front desks somewhere.
I bet they do.
Mhm.
Yep. And then we also have the room assistants where they go in and get the history, like
Mhm.
what Devin was saying, and ask questions prior. And we have teams. So vet assistants kind of learn what the questions the doctors want or the information they want up front and how much information they need in order to operate. So that's always huge to get the tone set for the appointment.
Yeah.
So
they'll like go in and get the history and then get the invoice ready for the technician. And then do the the invoicing as well. I think a lot of people are confused about that position, but
they'll call
it's
and
really
check on
nice.
patients.
Yeah.
Yep.
Lots
Reach
of
out to
client
clients.
communication,
Really establish that relationship.
lab callbacks.
There's so many
So many
things.
We
things.
could keep going on
There-
about what
there's
vet
definitely a
assistants do.
place for them.
Yes,
Yes.
there's definitely a place for them.
There will always be a
Yes.
place for vet assistants.
Do we
I
think
don't
vet
foresee
clinics
that
are
going
moving
away.
away from assistants and more towards techs?
I hope not.
No, I don't think.
I don't think so.
I think it just depends on what they need
Yeah.
to fill too. What spot they need
Well,
and
yeah.
what
Yeah.
every duty we just mentioned. What
and
do
how
they
the
need?
clinic operates, how
and
many
it's not
doctors
like
they
there's a
have.
surplus of technicians.
Yeah.
No.
No.
So like it's not like you're going to fill a clinic with all technicians
Mhm.
and then not have veterinary assistants
Right.
because
Right.
you have so many technicians. That's never going to happen.
Yeah.
There's tons of assistants out there functioning as technicians.
Mhm.
for the most part.
Yes.
Mm-hmm.
Okay. What are the differences in the duties between assistants and techs more specifically?
Monitoring anesthesia.
And sedation.
Mm-hmm.
Certain like probably laboratory tests that we run. So low dose dex test for Cushing's,
Mhm.
ACTH stimulation test,
Blood glucose curve. I mean, an assistant probably,
CRIs
yeah,
for
but
any type of
Yeah,
drugs
more
and
advanced
stuff.
patient care.
Yeah,
Mhm.
yeah,
Mhm.
euthanasia is
yeah. Depending.
Not the euthanasia, but like
Sure,
the
but, like,
process
yes.
of euthanasia.
Yeah.
Yep. Probably a more. I don't want to say higher education, but different education for questions
Sure.
with owners and
More knowledge
lab
about
results.
drugs
Yeah.
and how they work.
Exactly.
And so we'll see
so
what
more
else.
drugs to administer
Mhm.
as
Yeah.
well. Drawing blood, depending on the vet assistant's comfort.
Mm-hmm.
Cleaning teeth,
Mm-hmm.
right? So core procedures, radiographing.
Recovering after anesthesia.
Yep.
So that's all the things that techs do instead of assistants, typically.
And there's probably more that we're not listing.
Oh,
Yeah.
easily.
Oh yeah, lots more
Mm-hmm.
for sure.
Okay,
But I think if you work, and I think veterinary assistants can definitely help technicians, just like technicians help doctors.
yeah,
So, like, I think that if people are using the staff member correctly, then everyone wins.
It is beyond helpful.
Mhm.
Yeah.
Oh
Yep.
my gosh.
running in-house labs, urinalysis.
Mm-hmm.
Mm-hmm.
There's just other things that.
Oh, there's
Yeah.
so many the blood smears. I mean, there's
Yeah.
so many things.
Yep.
Mhm.
Is it worth becoming a tech?
I think it depends what your priorities are and what you want to do on a day-to-day basis.
Mhm.
There will most likely be a decent wage gap.
Yes.
That's probably going to be the biggest thing.
And responsibilities.
Yeah.
Yeah.
I mean, I think that there's a heavier responsibility
Sure.
load on the technician.
Yeah.
And
So
just having more to your name.
So yeah, you need to answer what you want to do.
Yeah.
Gosh,
I think
yeah.
it just depends what you want to do. I don't know if I would say it's like worth. I mean, I would think it's worth it, but it's like I said, it's what your goals are. You have to set goals for yourself and decide what you want to do later down the road.
Yeah.
So if that's what you want to do, great. If you just want to stay an assistant, great. I don't think it's either way is wrong by any means.
There's a spot either way for it.
yes,
for
100%.
absolutely.
Did we answer that?
Whatever.
Did we answer all of
makes your
it?
heart
I think
happy.
so.
Yeah.
I think so. Yeah.
Whatever
absolutely.
you think will fill your cup each and every
There
day.
you go.
Yes.
Okay. Our text message feature is still a thing. Keep using it. So you tap on the episode and your podcast provider of choice. Look at the top of the episode where it says send us an inquiry through a text message here. And if you would like a shout out, include your name.
Boom.
Boom,
Put your
baby.
name.
Put your name.
Anonymous.
And we talk about you.
Yeah, we want to give you a shout out.
We'd like to know your names. You know our names.
Yeah, that's a good point. Case collection.
Case collection.
Whoopity whoop.
Okay, I'll go because I
Okay,
don't
go.
know if we have another case ananyway.
Yes, let's
I
do
have,
it.
I'll go after you.
We
Oh.
both have one.
Ooh, exciting. Okay.
Okay, I'll go.
Are we
I'll
doing
go
3?
fast.
Okay.
Mine is a 1.5-year-old golden retriever, female, intact. And as a puppy, she had to go to an ER because she was having neurologic episodes. So, long story short, a series of tests were run and she was diagnosed with a portosystemic shunt. So, I have referred to her in the past when we talked about like an anesthesia question.
Mm-hmm.
So I took over her care when she just needed the routine visits and vaccines and things like that. And so with a portosystemic shunt, when it's diagnosed and the more specifics of where it's at, things like that, surgical correction can typically allow for correction of the issue in general, and then the animal continues to carry on. Well, that needs to be done by a specialist. And so with that comes a large financial price tag. And so these owners were unable to do that. And so the other option then is medical management of the side effects of the shunt. So basically the liver...
Tell us, everybody, what the side effects of the shunt are.
Yes. So basically the liver is not filtering like it should. So you have more byproducts in the circulation that shouldn't be. And so side effects is like if they have it from a puppy, is like they're smaller, kind of almost like I don't want to say half the size, but a quarter of the size of what a breed should be, because they're not absorbing as much nutrition. It's just, I don't know, it's just not correct. Nothing's correct. So they're not growing at the correct rate. And then as the clinical signs progress, you'll see some neurologic signs because of the byproducts that are in the bloodstream. So what happens is they may have seizures or tremors or like a weird mentation behavior. Those are kind of the biggest things that you go off of. And then to help just try to manage those, again, byproducts, toxins, however you want to look at it, there's medications which this patient was on. So lactulose, metronidazole, I added in amoxicillin later, and she was on a liver diet, and she was on anticonvulsant seizure meds from the get-go.
Wow.
Less than 1 year of age.
Jeez.
And we actually, at her 1 year annual appointment, we tried to start to decrease metronidazole first, and she couldn't tolerate it. So what happened is I ended up seeing her like 6 months later for a suspected UTI, and she was at once a day metronidazole at that point. And I noticed in the exam room, she would get really excited, and then she would like literally like kind of freeze and kind of stare off and then have to lay down for a second. Like she was having literally an episode in front of me, and it happened like a couple times during the exam. And even though it wasn't a full on like seizure, it was almost kind of like
she was like
zoning
stumbling.
out. Yes.
Too.
Yeah.
Like
yeah. That
wobbling.
was another thing we noticed too. She was not having a normal gait. And owners mentioned that she had some of that, but I'll be honest, I don't know if they noticed it either because they're around her every day. So we increased metronidazole back up and started the amoxicillin to treat the UTI. Her urine specific gravity was extremely dilute as well. It was like 1010 or something, which is also goes with the shunt. And they could be PUPD as well. So anyways, she unfortunately over the weekend had to go back to the ER because she was having multiple seizures.
Oh.
So they kept her in hospital, had to keep her on IV anticonvulsants and monitor her. And the next day they wanted to transfer her to internal medicine, but the owner declined due to finances. And so they just tried to manage. She had like minimal tremors by the time she went home. And so I was actually actively talking to the owner saying, okay, we're going to increase the Keppra. We're going to adjust the lactulose. We're going to increase the lactulose. We're going to keep her on amoxicillin long term. And then that evening when she got home, she unfortunately had more seizures and had to go back to the ER, and they euthanized.
Oh.
Because it's all about with medical management.
Yeah.
Managing those
symptoms. Yeah.
I did not know that.
Mm-hmm.
So sad.
This was the dog that we elected not to spay due to the severe risk and complications of anesthesia with her shunt.
Right.
And so the owner they're awesome. And he was like nervous, is she having a pyometra? Because that's why originally they came in, ended up not being that, thankfully. But yeah.
Wow.
Real bummer.
Yeah.
But they gave her the best year of her life.
Yeah, they really
They
did.
did everything they possibly could for her.
Yep.
With what they could do. And
yes.
they loved her tremendously.
Yeah. That's so sad.
Yeah,
Gosh darn it.
That's a big bummer.
They were also a really young couple who had gotten this puppy together, and then
Will the breeder
out,
replace the dog just by chance?
I do not know. I called to give my condolences yesterday and just left a message. So
Because that'd be really nice,
interesting,
you
yeah.
know, like that they didn't hand the dog back to the breeder.
right.
A lot of
They
breeders
took
will
it
do
on.
that. Yeah, like be like,
I mean,
okay,
there's
when's
proof
the-
that they did pretty much everything they could.
yeah.
Yeah.
Mhm. They're
Yeah.
good people.
Yeah.
Yep.
They're great people.
Yep. Okay, I can go.
That's a really
Sure.
good case.
I don't care.
Mhm.
Okay. Mine is a 9.5-year-old husky. They're a very close friend or a family friend of mine, so it was kind of extra close to my heart. But they reached out to me saying that he hadn't been eating for a few days, was vomiting, and was nonstop peeing. So of course we had them come in. We did some in-house lab work. So I'm just gonna go over this. CBC is pretty crap. It says it ended up being like 54,000 platelets, which is still very low. Not anemic. And then we've got normal glucose, normal kidney values, but then the ALT and alk phos were just a little elevated, and then T-Billy was also just a little elevated. So they were very tight on money, but we were able to do a quick fast scan with the ultrasound just to mainly look at the liver. We didn't see anything obvious, and then we did get approval to do one lateral x-ray because unfortunately that's all we could do. We were just trying our best. So we did one lateral x-ray. It was a right lateral, and the liver was massive. But we still couldn't see anything super obvious, like no super prominent mass or anything. So we kind of just threw a bunch of meds at him. We did Serenia, we did Clavamox, Metro, Denamarin, Serenia to go home. This was a Friday, so they started the meds over the weekend. I went over there like twice a day, Saturday and Sunday, and still not eating. We tried syringe feeding him. I helped them give him his meds, and every time I went there, it was so hard to see. He was just... The first time, whatever, he was lateral, and then the next couple of times he was just laying, but he did not want to move. He'd still go out and pee and drank a lot of water, but he acted interested in the food we offered him. He would like sniff it and lick his lips and then would just turn his head. And then his eye finally turned yellow yesterday. It was cool, like cool in a weird way, but he's a husky, so he has one brown eye and then one blue eye, and just the iris of the blue eye turned yellow. It was kind of like apocalyptic almost. But I was just in a really rough position because I want to be optimistic for them, but I knew how grave the situation was, so I finally was like,
guys,
I was like, have you guys talked about quality of life? And luckily she was like, yes, we have. So we did opt to euthanize him yesterday. But it's the hardest when you don't have the answers. We've been having a lot of those cases lately when like we don't have an exact answer and the animal just keeps getting worse and worse and worse, and we're doing so much or like all we can, but the owner's tight on money, so it's just hard for them to come to terms with it. And I know it's not going well on Dr. Ham, but
I think that it's really, you're right, it's hard to not know the answer. I think one way to rethink about it is you also know all the things it's not.
So
that's a good way to look at it.
Like, it's not, based on the lab, like the diagnostics that you have, you can eliminate a lot of things that are treatable. So you're left with this bucket of things that are untreatable typically. So although you don't know exactly what it is, you probably have a good feeling that it's unfixable.
Sure.
And especially after you go through medication. We've talked about like treating is a way of diagnosing. Response to treatment.
Also lack of response is also
is helpful.
Yeah.
I don't know if that's the right word. But I mean, so because I think this trend and how we're having to treat patients isn't going to change. You're going to continue to see this. So I think it's important to refocus or retrain or reframe your thinking into thinking, okay, it's not that we don't know what's wrong with them. We know a lot of things that it isn't, but some of them aren't treatable. Even if you knew what it was, you weren't going to treat that. Didn't matter. You could have figured it out, and you still would have been in the same place.
I mean, we wanted to do an abdominal ultrasound, but it still would have been the same turnout.
Exactly.
Yeah, the liver's still big.
Yeah.
Yep.
Maybe I'll try to imprint that on Ham.
Well, because I mean, like, think of all the causes for hepatomegaly, like significant hepatomegaly.
Like even I
mean,
looked
like,
at the X-ray and was
all
like,
those
that
are
looks
really
massive.
Steroid hepatopathy. Okay, but they're not going to have those values.
Right.
Okay, so what's another cause for a ginormous liver?
A mass somewhere.
Exactly.
It's all-
like, I mean, like,
it's all
there's
about
no,
out.
like, see what I'm saying?
Infiltrative cancer.
Yeah, so
Right.
I just had to treat him for hepatitis, but there was most likely a mass.
Right.
Yeah.
It's all
So
about
I think,
outcome at the end of the day.
I don't know.
Yeah.
It's just don't lose sight of that, I guess,
Yeah.
is my thing for you.
Important. Thank
Right.
you.
Yep.
Good job.
Oh, okay. Thanks.
Okay, bear with me on this case because it happened a while ago, so I'm kind of refreshing myself here. So I'm going to be reading a lot of the records, but okay. So he is now, I think, a little over a year old, but at the time when he presented to us in May, so it was May 17th, he's 6 months old. He is a poodle mix. He presented for appearing stiff when walking. The owners didn't notice if it was like one leg over the other. He didn't really seem to be in pain. No specific injuries that they had noted at home. Nothing out of the ordinary happened. So we did our initial exam. His right forelimb, he had lameness when he was walking. He had normal extension and flexion of the shoulder. The elbow of his right forelimb was difficult to evaluate on range of motion, and then as well as his carpi and digits due to anxiety surrounding the paw handling. So that was just kind of, and he was just a wild puppy. So it's kind of hard to truly examine them and take all that into account.
He hated his paws touched.
Yeah.
Like you went to go touch
Yeah.
it.
And so most of the time you're like, okay, it's a puppy. They don't want their feet touched.
How
They
old
haven't
was
been.
he? You said 16?
He was 6 months.
6 months.
At the
Okay,
time.
got it.
Yes.
Got it.
No joint effusion or long bone pain, palpated. Nails on his front digits were perfectly fine. Blah, blah, blah. Everything else checked out normal in exam. So our plan was to do strict rest and then medications at home. So we did Rimadyl for 14 days and then Trazodone for sedation kind of as needed to rest him because he was a puppy. So we went over strict rest with the owner, no running, jumping, playing, things like that. So the owner did that, and then she comes back on the 29th of May for a recheck for a reevaluation of his limp. They had not appreciated any kind of improvement at home, despite being on the anti-inflammatories, the strict rest, and keeping him calm. So we decided to proceed with sedated x-rays. Once we did the x-rays, on exam, there was still significant lameness on his walk, especially his right forelimb. When he was sedated, Dr. Duckwall was able to palpate him a lot easier because he was sedated. So everything was a little bit more movable and he wasn't able to pull away. He just did have decreased flexion and discomfort on carpi of both left and right forelimbs. Hyperflexion of digits on palpation in the front with resistance of range of motion and extension flexion of left and right front digits. So his toes were really stiff.
They're basically curled.
Yeah, his toes were not able, they weren't very movable.
Yeah.
They were just kind of there. And so she was like, okay, that's a red flag. And then x-rays, and then there was no foreign material, nothing like in the paws themselves that would be causing his lameness. And then x-rays, there was no fractures, no joint effusion, no soft tissue swelling, anything like that. Other than like his open growth plates, I guess you would say, because he was a puppy, so he's still growing.
Sure.
Nothing else abnormal. So everything on exam was kind of weird, but x-rays were overall unremarkable. So at this time, we did more Rimadyl just to keep him as comfortable as we could. We did recommend referral to an orthopedic surgeon due to how young he was, things like that, what we saw on exam. So there was a lot of different things that we wanted to rule out, but it would be just hard. So an orthopedic surgeon was the next option. Okay. So that was in July. That was in May. So fast forward now to October. The owners finally decided to take him to an orthopedic surgeon.
Because from then till
he was still limping.
He was walking
in pain. Yeah.
Yes.
Yeah. Everything
was he
very
walking
stiff.
like one of those dogs on
Very lame.
like
Yes.
where they go. Like, they're walking on a hard floor and
And
they
they
put
have,
their
like, their
nails
toes
out and it's like they're
curling
ice
on
skating.
Rimadyl?
Yeah. Kind
Yeah,
of
he
like
was
that.
on-
Yeah.
Oh my gosh.
I don't know if he was on Rimadyl that entire time until he got into the orthopedic surgeon.
Well,
I feel
we
like
talked about it at the recheck too, and I think she did it as needed, or
Yeah.
he might have.
I don't think he
Oh
was
my
on it
gosh, the
daily.
poor dog. Okay.
but he was
Surprises me,
still
yeah.
he
Yeah.
was still very, very uncomfortable. So he goes to a specialty clinic that we referred him to. And the orthopedic surgeon actually, he didn't really know, like he didn't see anything other than like what we saw. And he actually recommended right forelimb amputation.
Well, PT first.
PT. Okay. Sorry.
Yeah,
I didn't
so
see
they
that
did
part in
PT
here. Okay.
for a while.
Okay. Physical therapy.
because they said they didn't know what was wrong.
Okay. So
Yeah.
physical therapy, but everything ended in amputation of his right
They actually
forelimb.
did that?
And
missed
he
you guys'
was
team.
Right front limb became very atrophied from not using it as well.
Yeah.
The left one was better. It almost like the ligaments, whatever was happening, started to
like open up, kind of becomes a little more
loosen,
lax.
release, whatever. They still don't know what
Yeah.
the cause is.
Yeah.
Yeah.
That's what I was going to get to. So they did the amputation, and they did send off they sent off some samples just to see if they could find the source of kind of what was going on. And the histopathology came back, and it says, unfortunately, the biopsy of the leg did not reveal any gross abnormalities that could explain the contracture of the flexure tendons. And it says, we are left with suspecting this may be something congenital, which is concerning as there is evidence this is causing a minor impact to his other digits. Not sure what his long-term prognosis is. But as far as we know, I mean, he's doing well, but it's just frustrating.
I'm pretty sure he was doing PT between when we saw him
and maybe that's why there was gap. They weren't doing nothing.
Yeah.
I should have
What
prefaced
was
that,
the breed again?
He is a poodle mix.
Yeah.
He's a doodle.
Is there anything that they get?
I mean, I
Like
think
poodles?
it was
Like HOD isn't an option?
no, that
No.
we would have seen on X-ray.
Sure.
Yeah,
But
because that's what you guys brought up when you did X-rays,
Yeah.
but it wasn't.
Yeah.
I think he was like a Newfie poodle mix, like a big,
Yeah.
large breed because
Yes.
he grew fast too.
Yes.
But he was on puppy diet, like all of that
That's such
stuff.
an interesting
There's
case.
just so
Do you remember that
odd.
one?
Yeah,
It
I
was-
do.
it
Now
was
that you're talking
bizarre.
about it.
Yeah, because when they did the exam, we're like, why are his toes so stiff?
It always
Yeah.
makes you feel a little better when the specialists are like, I don't know.
Yeah.
They
what's
did.
going on.
They did say one thing about the webbing of his paw pads. What did they
Mm.
say? Do you remember what they said?
I don't remember.
This is so
There was
odd.
something about the webbing of his paw pads too was not normal.
If you guys don't know, I used to be on their team, and now I work with Dr. Ham. So, like, I met Harlow and Rolly
Yeah.
at their puppy visits, and now, like, I haven't heard about this at all.
Yeah.
And then, like, 6 months later, I'm finding out he had his leg amputated, and Harlow got euthanized.
It is hard
and
not
I'm
to
like,
be in the know.
Like, what
Yeah.
the heck? Like, that used for my patient.
Yup.
Oh my god.
He's
The
doing
guys-
okay, though.
It was a very
those are
crazy
great
case.
cases, you guys.
Yeah.
Wow.
All of you had great cases. Fantastic.
Yes.
All right, Merry Christmas, everyone. I have to get
She's got a
going
dip.
early. They're gonna
Oh, that's right.
they're
Okay.
gonna finish up with the listener question. It's a really good one.
Okay.
Oh wait, he had abnormal webbing on all digits of all of his limbs.
Duckwall, thanks
what
for
are
our
they-
Christmas
okay,
presents.
anyway.
Um,
I don't know. Just not normal webbing. Okay.
All right, let's go on to the listener question.
you read this one, King.
Okay. Hey guys, this is a long one. Did I do that well?
Good job sounding that out.
Actually,
I was gonna say long.
that's what I was going to say. I meant the
Long-
G's. This is a long one.
Yes, good.
Perfect.
Okay.
So bear with me. I'm an undergrad student majoring in biomedical sciences. First of all, I'm sorry. Working towards getting into vet school. I was previously going down another path, and after getting a job as a receptionist at a vet clinic, I came to the decision that there is nothing more I want in life than to be the voice for those who don't have one.
Preach it, girl. Sorry.
I have worked at this clinic for almost 2 years and have recently started dipping my toes in the water of being a tech, and I absolutely adore it. My practice manager recently asked if I had experienced any fatigue in the field because I am an extremely empathetic person, but also the one that everyone looks to for positivity. I took it as a compliment, but it made me get to thinking, and
You're reading it correctly.
okay.
You are.
And a fear of mine is experiencing compassion fatigue before even getting the opportunity to truly work in the field.
The sentence makes sense.
1, what are some important things I need to focus on while working towards being a tech? And 2, how do I curb fatigue before experiencing it? Or is it something I need to prepare myself for? Y'all's podcast is what gets me to work in the morning and home at the end of the day.
Love that.
Keep doing what you're doing, and thank you for the fun and educating pod. Anonymous.
Everybody's anonymous today. We
I
can't
know.
shout anybody
It's like
out.
one-sided.
That is a great
Yeah, no
listener
kidding.
question.
I think, yeah,
No,
that's
I
a
love that
beautiful
question.
I just want to say one thing before we get into like the actual question. Good for your practice manager for checking on you and your mental health. Just gotta applaud.
Yes.
Or
Yep.
whoever asked you.
Absolutely.
I think that's
Absolutely.
awesome because, practice manager, your practice manager and anybody, I guess, in the leadership role should always be checking on their staff. I think that's very, very important, and it makes your feelings feel validated. And I think that's awesome. I just had to say that.
No, for
Yeah,
sure.
Because it's
no,
very,
that's
very important.
It's very important.
That's fantastic.
First question, what are some important things I need to focus on while working towards being a tech? I just want to say, actually, before we get into this question, that when I started at All Star, I also was very, very happy, and people would ask me how I'm so happy, and I'm still happy, but that empathetic, outgoing person has definitely faded. So it's just good that she's having this conversation
Yeah.
before she gets to that point.
Yes.
Yeah.
I'm still happy. we're working on it, but I definitely understand where she's coming from.
I think that, okay, so what are some important things I need to focus on while working towards being a tech?
Take it easy on yourself. I know that is easier said than done, but
don't judge yourself so hard.
yes.
If you miss a blood draw, if you miss a catheter, if you miss a cysto, it's not the end of the world. You just started. Don't compare yourself to other techs who have been in the field for years, because I don't think that's fair to you to beat yourself up. And some days other techs have bad days. You're going to have bad days. Just move on and learn from it.
She's been
Don't
coaching
hold
me
on
lately.
to it. Do not hold on to it, and do not take that home with you.
So she's in school right now. She's an undergraduate student.
Yes.
With the hopes of getting into vet school.
Right.
With a biomedical science degree. Wow. Right?
Smart.
Mm-hmm. Yeah. So I would say just be a sponge on the wall.
Mm-hmm.
And one of the things that, because ultimately you're going to pursue being a veterinarian, so it's really good to understand how you utilize technicians.
Mm-hmm.
And so that's one advantage of being a
Mhm.
technician, is that then you
that's
would
good.
understand how
Yeah.
to utilize a
How to
technician.
delegate.
Mm-hmm. Yeah, for sure. So watching how those
Mhm.
relationships are built,
Mhm.
watching how the technicians communicate with the clients,
Yes.
is also really helpful.
Yeah.
And I would just learn, if your ultimate goal is to be a veterinarian, then I would draw on the experience of the experienced technicians to teach you the skills that you
Mhm,
need,
mhm.
like drawing blood, giving vaccines, animal restraint,
Yeah.
like a lot of the big things, so that you kind of have those things under your belt.
Yes. Yeah.
As far as how do I curb
absolutely-
fatigue before
I
experiencing it?
know. I really
Oh.
think you should just like completely shut off your phone and your brain when you get home from work, and do not work outside of work. Again, easier said than done, and we're all guilty of it, but
Mhm.
I don't think it's a problem necessarily to work outside of work. I think that people care more than the client cares.
I was just
Yeah.
going to say that.
So people care more than the client cares. And what was the other thing I was going to say? What was I going to say? There was 3 things. I was like, I got to remember these 3 things.
sorry.
No. Heck no. No.
But know your limits.
Know your limits. But I think that people, one of the things I remember now I was going to say is, Sunday is a day of rest. For the love of God. You do not, okay, well, I mean, you may work on a Sunday, so your Sunday may be a different day of the week.
Sure.
But my point is, you need to rest on a
Yes.
day. So I don't think people are very good at taking care of themselves outside of work.
I would
So
agree.
they overextend themselves when they're outside of work, and then therefore come into work tired.
Mm-hmm.
And then that just, then it just rolls
Yeah.
on itself.
It's
Yeah.
a vicious cycle, and it
Yeah.
doesn't stop.
And it doesn't stop. And you know what? Every time you say yes to something, you're saying no to something else.
Mm-hmm.
So every time you say yes, I'm going to go to this concert tonight, you're saying no to being rested and
Mm-hmm.
energetic and in control of your emotions the next morning. That is fine, except know what you're saying yes to and what you're saying no to.
Yeah.
And don't do it every Thursday night, like when
Right.
you have to work Friday morning.
Yeah.
So I think that's a big part of it as well, you
Mhm.
know, is understanding those limits of
Mhm.
yourself,
Yep.
you know?
I definitely have a bedtime during the week.
Yeah.
And like just from personal experience, because on like Sundays or the weekends or my day off, I would, because we have one day off during the week and then we have weekends off. So like on my day off, I would always feel like I had to be doing something, like I had to be productive. Like I'm not just
Yeah.
going to sit at home and do nothing. But what my husband and I have done, especially on Sundays now, is we have lazy productive days. So like we'll do little stuff here and there outside, like around the house. Like
Yeah.
we'll get the laundry done, like the basic stuff for the week, but we're not going and like running a whole bunch of errands and making plans with people. Like
Uh-huh.
we try to keep our Sundays as unbooked as we possibly can.
Yes.
So then we feel like we're rested, we're reset, and then we're going into the new week. Not that we're like you said, tired on a Monday. Who wants to be tired on a, yeah, you're tired
Right.
because
But
you're
then you
coming
have
back from a
whole
weekend,
week.
but like don't feel like you're being lazy. Take care of yourself.
Mhm.
You need to rest. Everybody needs to rest.
Mhm.
So what were you going to say? I cut you off.
No, you were saying that like going into work on Monday,
Mm-hmm.
tired is not it. And I was like, then you have a whole week.
A
Yeah.
whole
It's
week to be
not it.
tired.
Yeah.
You need to be eating correctly, you need to be exercising and sleep.
Mhm.
You've
I mean, you're
got to be
gonna
getting
tired
sleep
at some point,
Yeah.
but
and have friends
definitely
outside
things
of
you
your
can do.
work
Yes.
that bring a different perspective.
Yes.
Mhm.
And to your point of getting off your phone, get
Mhm.
off your phone.
Yeah.
Mhm.
Like, I mean, I think that it's if your mind stays busy constantly,
Mhm.
you're scrolling. One, you're dream scrolling. So you're looking at all the things that you think you should be having or should
Yep.
be experiencing that
Yeah.
other people are doing, which creates a lot of anxiety
Mhm.
and worry and then emotional distress. Like, you don't need to be doing
Mhm.
any of that crap. Like, have a hard stop where your
Yep.
phone
Yeah.
goes away.
I honestly put my phone on Do Not Disturb permanently because you can edit like who notifies you.
Mm-hmm.
So I just have a few people that can notify me, and it has helped my anxiety.
I'm one. No,
so
I'm not
much.
really.
No, but seriously. So now it just doesn't like keep lighting up, and
Yeah.
it's just nice.
Yeah.
Have a little bit quieter of a life.
Yeah. I just want to
That's
revisit.
a great idea.
I just want to revisit
Yeah.
what you said. You can't care more than the client.
No.
I am like, I've been in the field for however many years, and I have taken a long time to realize that because it's hard. Because, like she said, you want to be their voice, and you can only be their voice so much because you're not their owner.
Right.
So you can't care more than the owner does. You can care, don't get me wrong, but you can't because it'll get you.
Yeah.
It'll get you really hard.
And you can't go down the road of like judging the owners for what they are and aren't able
Right,
to do.
that's
That also
another hard
creates
thing.
a whole bunch of,
Yep.
Mhm.
Yep.
strife in your head. And so really, your job is to educate, provide an opportunity.
Yep.
And then move on.
And I'm sure that at the end of every workday, like that day, you've done everything you can. You've done the best you can. So just try to get some sleep that night. And
Yes. And that brings up a really good point is how you measure yourself.
Mhm.
We've talked about that before where you should have a way of measuring yourself so that at the end of the day, you can be like, yeah, I did these 5 things.
Yep.
I'm good.
Yep.
And then you put it away.
Mhm.
Yep.
Deal with the facts, not with emotions.
Mhm.
It's much
So-
easier to focus on like the negatives of the day than the victories.
Yeah. It
So,
really, you're
or
absolutely right.
losses or
Yeah.
victories.
Yes.
But I'll have a rather perfect day and almost one catheter, and I'm thinking about missing that catheter for the next 2 days. So
Mhm.
Yeah. The one bad thing ruins the whole,
Yep.
yeah.
whole good day.
Yeah, that's what I've been trying to tell myself. I'm speaking a lot of personal experience because why not? But I've been telling myself, like, after a really hectic day, which I most of the time like busyness, but like after a day that you just feel like you got hit by a bus, like you're just done. You're like at the end of the day, really think about everybody you helped. Think about all those people you helped and you helped save their little fur babies. Like, just really think about that.
And I will
pride
say the
yourself on
last
that.
thing I will say is there are some people, and I don't think it's because, and I'm one of these people, I don't think it's because we're cold hearted. I just don't think we suffer from emotional like fatigue. I just
That's
don't think,
okay.
I think it's just a thing that like we just don't go there.
Mhm.
Either it is compartmentalized to
Yeah.
such a degree that
Yeah.
we don't enter into that headspace.
Yeah.
So if you are a person who is like that, that's okay.
Right.
You don't have to be a person who goes down that road.
Yeah.
Just because other people do, that's important and they need to take care of themselves, but it doesn't mean something's wrong with you
Yes. Everyone grieves differently.
if you're doing it differently.
That's a
Yeah.
great thing to say.
So like, I
Yes.
just don't want somebody to be like, oh, what's wrong with me if I'm not
I
feeling
don't get
this way?
emotional
Maybe I'm
fatigue.
not caring enough. Maybe I'm not loving enough. Maybe I'm not. And it's just, I think people
That's
are
not
just
true at
built
all.
different.
Yeah.
No, everybody's
absolutely.
fine. Like,
that is
just,
also important.
yeah.
You're in the field for a reason. You still care about animals. You
Yeah.
just don't. Some people don't wear
Right.
their heart on their sleeve, and that's okay. You don't have
Right.
to. That's fine. That's a very good
I
thing
think
to
we
say.
hit it.
I think we did.
Oh, make sure you find something that you can decompress with at night. Coloring is a great one. If you like to read a book that's not vet med related.
Yes, exactly.
Okay, that's all I got now. I'm done.
Okay.
Okay.
Does somebody want to take away the outro?
I will.
Yes, Devin, go
Okay.
for it.
Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. And if you're attending VMX, make sure to buy tickets at to the Veterinary Roundtable live at Ole Red through the link in the episode notes or on our social media pages. We'll see you next week for another episode of the Veterinary Roundtable.
Merry Christmas!
Merry Christmas! Happy New Year!